Good morning, everyone. Welcome to the third of our webinar series. Today, we will discuss what we're all dealing with, COVID-19, but from the angle of its medical, social, religious, and political impact on Israel and the American Jewish community. To moderate our discussion, we have with us today Rabbi Rachel Yurovitz, a member of Ruach Hidush's Executive Committee and past president of OALA, the Jewish Renewal Organization of Rabbis and Cantors. We are really honored to be joined by Dr. Alon Moses, head of Hadassah Medical Center's Department of Epidemiology and Infectious Diseases, hard to pronounce, and Eli Katz, deputy mayor of Teaneck, New Jersey, and Dovz Zakheim, who has held significant positions in the U.S. Department of Defense and now is chair of the JREC, Jewish Religious Equality Coalition. So Rachel, the floor is yours.
Thank you so much. I want to thank everybody who's taken the time to join us today for this webinar. And I want to thank in particular our presenters for taking the time out of what have to be exceedingly busy days to help us understand what's going on here in the US and in Israel, within the Jewish community in particular, related to COVID-19. We recently read in Parashat HaShavua, going back a couple of weeks, about the Kohanim being called upon to be arbiters of contagion and determinations of when it's safe for someone who is contagious to return to the camp. And now the camp is the planet. And all of us, as part of a Mamlechet Kohanim, with all of our brothers and sisters on this planet, all of us are called upon to make responsible choices and to act in ways that help reduce the danger for everyone. So heading efforts to support that goal, we have three distinguished presenters today. I'd first like to call on Dr. Moses from Hadassah Medical Center to give us an overview, first of all, to give us a sense of the steps that have been taken and what is currently being undertaken by doctors and scientists and the government and communal leaders to stem the spread of COVID-19 among Israelis, and also perhaps to give us a sense of the degree to which the response of different elements of Israeli society to the guidelines and the necessary shifts in behavior might have exacerbated tensions within Israeli society. So Dr. Moses, the next 20 minutes are all yours.
Thank you very much. Good morning, good evening from Jerusalem. It's a pleasure to be here and an honor. We are now in May, and I think everybody on the globe feels he's an expert in coronavirus. And if we go just a few months earlier, when it all started in January or maybe even December, we were overwhelmed slowly by what has turned out to be one of the biggest epidemics in the last 100 years. Certainly, I, as an infectious disease doctor, was not aware that I would be part of this epidemic. In the beginning of my years as a physician, I confronted HIV and AIDS. And at the time, we were seeing a new disease, and I think in many ways, we are now learning about this new disease. We've known infectious diseases and respiratory infections for a while, but as we find out, this is different than what we have known. In the beginning, I think that many countries were in denial of what is actually happening. And I think everybody took turns in the degree of their denial. And there's a shift from denial to maybe over expression of fear and over expression of the stressing of the dangers. And I think the golden path is yet to be found where we need to move from realizing the truth of the danger and not standing by the side and waiting for things to happen on the one side, but we see our leaders often use the situation to get their goals going. And if I look along the time from the beginning of the decision making, I think that we are still lacking the making decisions according to facts. I am reminded of my first encounter of patients with COVID-19. It wasn't called that in the beginning. I was asked at the end of January if a group of Chinese dancers could come to Israel, 25 dancers, and I was concerned and told the producer that he should not bring the dancers in. And when I asked, he was of course a businessman and wanted to bring them in. And when I discussed this issue with a senior Ministry of Health person, he didn't see the danger. And my first discussion with him was, well, there's no problem, we're having Chinese people coming in on a daily basis, but it took him only a day and a half or two to grasp his wits. And actually, he told me, maybe I can't force them not to come in today, but they probably should not come in. And that was really the beginning. And Israel was one of the first to close the skies for Chinese air flights. And I think that was a good decision. I'm not sure it was based on data and knowledge. And as I said before, it was a good decision, and some of the good decisions were made in Israel. And I think and I support most of the decisions of our Ministry of Health, and I think they should be proud of what has been achieved in Israel. I'm not sure we can actually attribute all the success and the low mortality in Israel to decisions that have been made. And I think now that we are sort of exiting all the stay home, decisions are again made, not definitely according to data. And if we look at the country, for example, now, in Israel, there are just over 5,000 actively sick patients, 3,000 in my city in Jerusalem and 2,000 in Tel Aviv. And all the rest of the country is just several tens of patients. And I think that the government, the Ministry of Health, is not looking enough at cities like Haifa, which have 0 cases for quite a while, and they could probably have been freed from the restraints much earlier. So I think this is one type of data that I allude to that is not being followed close enough. We also need to do, and the discussion, we all know that the way to deal with the pandemic is to know more, to know who the carriers are, to know who the asymptomatic sick people are. And we are still at the point, there's much discussion about what to do, and we are still at the point that the non-pharmaceutical interventions have the highest effect, meaning social distancing is probably the best thing we can still do. And the price for it, of course, is economic problems and maybe catastrophe, as our politicians say, so that the non-pharmaceutical interventions, which are essentially most of what we have now, because we do not have effective drugs that can be given to everyone. There's maybe one drug which has been shown and approved by the FDA to be given for severely sick people. There's no drug for prevention, and there's no vaccine. So we are left really with very primitive means of fighting the pandemic. I think compared to other epidemics like Ebola, where we were in a similar situation, that there are no pharmaceutical interventions, so that only distancing, isolation, and quarantine were effective. We now have the ability, to make mathematical models, and these are being put into effect in the return to work. Kindergartens are coming back for only a few days, and there's talk that workers will be back for only a few days, so that if they are infected, they will develop the disease at home. There are several mathematical models which are trying to solve the question of how to do best the non-pharmaceutical interventions. We at Hadassah have just opened a new study for the prevention, or what we call post-exposure prophylaxis, by giving a rather safe drug, the famous hydroxychloroquine. There's a study, there are 2 or 3 studies like that which have been begun in the States in the past few weeks. And there's a big question whether hydroxychloroquine can prevent the infection. It certainly has effect in vitro against the virus. We've known that for a long time. And it may have a clinical in vivo effect. And I think that such a study of post-exposure prophylaxis, it's given for patients who are, or for people who were in contact with cases proven to have the virus. If this intervention can be successful, then it would really be like a vaccine, because people who have been exposed could get a simple drug for a few days. So we are hopeful that this will have an effect. I was asked whether the viral infection had an effect, a challenging effect on democracy. And I think that we've seen some pretty horrifying things that have been done if it were not for this very severe disease. I'm an infectious disease doctor, and for years I have to decide, although rarely, but I have to decide between the freedom of the private patient and the public health. And every now and then I'm confronted with a tuberculosis patient who doesn't want to be treated, and the law is on our side. It's a 1938 or 1942 law which allows us to force a patient who is in danger for the community to be locked, to force him to receive antibiotics. So we've seen this for TB. Just recently, 2 years ago, I was called to the court to force a patient with measles to be locked down in a ward in our hospital because he had a psychiatric complication of measles, and he couldn't, and he wouldn't stay in isolation. So we have been confronted with legal issues of infectious diseases for many years. But now, when our government decided that the position, the whereabouts of our population would be followed by the Secret Service, it changed. It was a different magnitude of behavior. And the initial decision was without the authorization of the Knesset, and there was bad feelings about it. But I, as an infectious disease doctor, support the idea, because I think that part of minimizing our cases was the ability to tell someone that he has been in contact with someone who is positive. But it's still a challenge, and I think the recent decisions to let go of the curfew and to get back to normal life has been because a lot of pressure from different parts of our country. Like the synagogues were closed almost last in Israel because of political pressure, these are some of the things that have been opened first. I'm often asked about the mikveh and can we allow men or women to go to the mikveh? And I feel some of the questions are certainly genuine, but others are from with political pressure. I think that at this point we have actually our two big populations which are sicker than others are the very religious, who in the beginning were not listening to suggestions to stay away for the social distancing. I appeared on the TV channel for the Haredim, the Kikar Shabbat, about 6 weeks ago, and I think that was a good connection with our Haredim. If I look, and then we had similar difficulties with Arab focuses in the country. I think this has changed now. I think that we are more united, and the unity is also in behavior. I think that the last 10 days or a week or 10 days have been characterized by people going out much more. And I'm often asked whether this is just because of the virus is really disappearing, or because people are just have decided that they've had enough. When I look at the number of cases we have, it and there's every day we have less cases, and if you look at the graphs, we have less severely ill patients and less ventilated patients, and it reminds me of the yearly flu. The yearly flu season in Israel begins in November or December. The cases rise until a maximum in February, and by the end of March, we see very few cases, and at April, everything disappears. And I have a deja vu that this is what is happening, although, with influenza virus epidemics, we do nothing. We don't have any social distancing. So at this point, I can't say that it's the same, because we're doing so much to try and prevent coronavirus infections. I think that the next 10 days in Israel, maybe even less, a week or 10 days, will tell us if there's a new surge of infections or if the disease is actually going down. When I look at other countries, especially the US, it's very clear that things are not, have not reached the climax there. I think New York may be different. New York has less and less cases, and it looks like there's some a decrease in the numbers, which is significant. And you can probably see yourselves that the population is beginning to act to that. So to summarize, I think that we have actually to wait for medications which will prove for the severely ill, maybe early medications as secondary prevention or post-exposure prophylaxis. And a vaccine, there's a big question whether we will succeed to make a vaccine. There's no clue at this point that this is going to happen. We all remember that HIV has been around for 40 years and there's no vaccine yet. We remember that Ebola is around and there's no vaccine. And we remember that even influenza, where we have a vaccine, the virus tricks us every year and we need to make a new vaccine every year. So I think there's a lot still unknown, and it will take another year for us to know more. That's it.
Thank you. Thank you so much, Dr. Moses, for that overview. I know that there are a couple of questions people have for you that we'll circle back to after we've heard our other two presenters. And please note, those of you who are attending, if you have specific questions for the speakers, please post them on the chat, and I will do my best to capture them and share them with the speakers after we've heard their introductory presentations. I'd like to invite at this point Deputy Mayor Katz from Teaneck, New Jersey, to uncloak and unmute himself and give us a sense, hi there, Ellie, give us a sense of what it was that prompted Teaneck to act as expeditiously as they did, and in terms particularly of social distancing, since Dr. Moses has spoken of the concern to have people make fact-based decisions over decisions driven by preference or politics or fantasy. We're very eager to hear how you managed to do so well in Teaneck.
Thank you very much, and thank you for having me. So my name is Ellie Katz. I'm the Teaneck Deputy Mayor, former mayor. And so taking us back, I guess it's 8, 9, 10 weeks now. I don't even know. To me, a Sunday is a Monday and a Monday is a Wednesday. Everything's all mixed together. But I've been in this basement literally the entire time. Very little daylight, which is not a positive. I should get out there more often. But I get information every day from the town as far as what is going on and who passed away, the ages, I don't know who it is, but I know the ages and male, female. So it's very surreal for me. And I've also been very active as far as trying to keep our residents physically safe, mentally safe, spiritually safe, financially safe, as much as we can, bringing them as much information as I could on a daily basis. But I was there the night that the mayor got on TV and sent out an email that we have to quarantine. I guess the straw that broke it for me is it was Shabbos at around, it was the Shabbos right after Purim, right? And it was about 2 o'clock or so, and a police officer pulled up in front of my house, and they said, this is a message, they've been trying to reach you as people from Passaic. Apparently there's this very prominent rabbi in Passaic that had symptoms. Right? Remember, this is in the beginning when if you took a test for corona, it would take you 8 to 10 days to get back, whether or not you're positive, negative, whatever it is. So the symptoms, and he insisted that we let this Teaneck resident know that was helping him move, that he was with him all day, that he must take every precaution necessary as if he had it himself. So they were trying to reach me, and I didn't answer my phone because while I do carry my phone 24/7, I usually just look at the text or listen to the message afterwards. I don't answer every phone call that comes in, especially not on Shabbos. And that to me was very, like wow, this prominent rabbi was felt it so important that he not just had messengers try to get in touch with me, but they sent the police department to my house to say, call this person and go, advise this person. So I immediately called the mayor, and I said, listen, there's a person on the other side of town. Can you do me a favor? Can you go over there and, let them know this is the information? And then we reconvened, and certainly we were aware of what was going on in some of the schools. That people were getting sick, that some of the schools, people were staying home and being quarantined. We were aware of what was happening in Westchester at the time. But it really hit home when, we started getting more and more of these reports. And Sunday morning, we made the declaration for Teaneck that everybody should voluntarily self-quarantine. And that was picked up by every media channel because we were the first. We were certainly the most prominent. We are fortunate that we have a phenomenal hospital in our town by the name of Holy Name Medical Center, and they are always on the cutting edge of different issues, and certainly this was one of the issues, so they were getting attention. So Teaneck, unfortunately, because as a town that I love, it's sad to say this, but we were becoming synonymous with the word ground zero, which obviously for many of us have a completely different explanation. And I hated that word, and I never used that word. But we were the first to get out there and beat the drum and tell people how serious this is. Stay home. It's not required. It's requested. Self-quarantine. Wash your hands. Social distancing was like just becoming a word, so we were like, okay, and social separate or social, whatever this word is. And we started, pounding and telling people, this is what you got to do. I've been in touch with my friends in Israel, and they were telling me what was going on there. And Israel was probably 2 weeks or 3 weeks ahead of what was going on here. And they were saying how serious Israel was taking it. And I'll tell you, I got a lot of people pleased and thanking me. Certainly there was a lot of confusion. And I got some very strong hate emails and calls from people saying that you must call my boss. They said because I'm from Teaneck that I can't come to work, or Amazon refuses to deliver now because we're a Teaneck address. And all of a sudden Teaneck became the name synonymous with Corona, which I guess because we were the first, and I guess nobody wants to be the first in this. They want to be the first in other things. It was very hard. It was really 18 to 20-hour days, and it was so much misinformation going on. What do you do? Don't wear masks. Do wear masks. Wash your hands. Count to 20. Make sure it's hot. So wipe down everything you get. Wipe down your food. And I somehow became that lightning rod, or the person that people went to, not just for, okay, do I wipe down the boxes? Can I order food? Because we also said that there's no more restaurants. I went to a meeting where the clergy said, we were the first in all this. The clergy said we have to shut down all the houses of worship. Now, it's very simple to now that we look back and think back and say, oh yeah, of course. it was not such it was a contested meeting. I mean, it was, imagine the clergy members coming out and saying, you know, we have to shut down the house of worship as of this date. It was not such an easy thing. It wasn't such an easy meeting. And you had doctors at that meeting, you had rabbis, you had community leaders, we took the strong position to do it. And I applaud them for doing it. Obviously, when you look back, you say that saved lives, right? I mean, to constantly put these people in an environment where we're very social and we're going up there and shaking each other's hands and whatever else we do, that literally saved lives. Could it have been done earlier? You know, everyone likes to Monday morning quarterback. Should have done earlier or later, but we did it very, very expeditiously in Teaneck, and we got a lot of attention. Not the attention that we wanted, but we got a lot of attention, and we also made people very hypersensitive to what's going on, to the point where everyone wanted to now get tested. And I would get a lot of those questions. You know, I have a headache, or I think I have a headache. What do I do? I made sure that I did not cross any lines, because the last thing I wanted to hear is that, oh, I sent an email to Ellie Katz and he said, don't worry about the headache, take 2 Tylenols, call me in the morning. So I made sure I didn't cross any lines, that any medical questions that were sent to me, I specifically made it very clear, consult your physician, which unfortunately, sadly, at that point, their physician probably knew as much as I did, if not less, depending upon who their physician was. But that nonetheless, they are the physician, right? And I'm not. So I was very engaged. And then I started hearing from the community regarding the business community regarding how are we going to survive this. And at the time, you know, the government didn't come out with packages. They were talking about packages. And I pulled together some of the local banks and some of the community leaders. I was very fortunate that I have a very good contact in the governor's office. And she was very helpful to me, giving me resources. So we pulled together a financial call, and the call was packed. Then we did a couple of community calls. Like the first community call, when it first started coming out, before we came out with our notice, we had about 400 people on the community call. The second community call, we had 1,000 people. And the third community call, we had over 3,000 people. And it's not a Zoom, it was a phone in. We were allowed to have like 1,000 something, 1,500. It broke the line. And since then, what I've been doing, and obviously as time went by, you know, more information came out. People, you know, we started getting, I guess, more now. Now we're getting a little more less restrictive on the on our requirements. Like we started opening up parks for passive recreation here in Teaneck. But the governor right away in the beginning said, after he saw the Wild West, where the Teaneck came out with their rules, and then the county came out with their rules, and then other towns came out with their rules, the governor said, listen, one rule, my rule, and everything else is, we supersede everything else. So then we had to yield to the governor and everything he was doing, and he came out daily with different protections. But what I've done in the last, whatever, let's say the time, is I've tried to, in the beginning, educate, certainly as it kept on evolving. But then I also put together different community phone calls of different types to help. So on Sundays at 3 o'clock, every Sunday since the beginning, I have 5 or 6 clergy members that join. And it's not just from Teaneck, by the way. I have several clergy, a clergy member from Israel yesterday. And I had a clergy member from North Carolina. But every Sunday I put together a phone call, which is like a clergy interfaith support call. And it gets a lot of people there to help strengthen them spiritually, but also I think it also helps them mentally. But I did set up a call once to twice a week now where we do a mental health support call. And and I have every night or every other night, I have different therapists speaking about different topics. Um, and that's very well attended. And then last week, I was able to get a doctor who was on the front lines, who was a cardiologist in Englewood Hospital, and I set up a like a one-on-one with him, so that people could hear about his experiences. How he went from a cardiologist to the corona specialist, and that was very fascinating. But I think what people are missing from or people needed or craving were more of a local flair on what's going on. We're all watching the news, we're all reading the news, but it's very like national. I wanted to bring it more local. I wanted people to understand, like, this is a person here in Teaneck, a doctor here in Teaneck, and this is what's going on, and this is the experiences, and this is how many deaths and people are getting sick from Teaneck. So while in the beginning our numbers were the worst, because I believe that we educated the most and probably scared and sensitized people, now when you look at per capita around us, people are saying that our early actions, our early intervention, the different things that we've done save lives, which is very comforting to hear that, because that was certainly our intention. And our numbers would have been off the charts had it not been for what we did, based on, if you look at some of the neighboring towns and their numbers per capita that might not have had it. So that was basically, and that is basically my last, like I said, 8 weeks, 10 weeks, whatever we're in right now, since March 4th, I think, or 6th. And I continue to do it. Every night I have some type of call with the community. And every morning I try to send out an updated, what I call my Teaneck tidbits, which is my personal information disseminated to the community and beyond, as far as what I've heard, what I hear. So for example, the hospitals just came out with a release this weekend. One of the, I guess the collateral damage is that people are afraid to go to the hospitals if they don't have corona. And that means that they have chest pain at home and difficulty breathing at home and whatever other ailments. And they're suffering, or there's unfortunately death because of that, from what I've heard. So they put out a press release and saying, hey, don't be afraid, come in. The hospitals are not where we were 8 weeks ago or 10 weeks ago. And that's what I try to do. I try to disseminate as much information as possible and try to give or be a response to the residents of my town and beyond. And that's how I've spent the last, and I've gained about 10 or 15 pounds, by the way, and I wasn't skinny before this, so that's not good, But listening to some of my friends, it sounds like I'm not by myself. But it's been challenging and nerve-wracking, and it's been a mental, emotional roller coaster. And quite frankly, as active as I've been, there have been days that I went to sleep really torn. I took melatonin to try to knock myself out, because I recognize how important it is to try to get sleep so that my body stays like physically healthy. I created a daily routine as far as my own cocktails based on my medications that I take, and the zinc and the Centrum and whatever it is, because in the beginning they're saying, oh, take this, don't take this, drink this, don't drink this, eat that, don't eat it. So I created my own routine to try to make sure that I stayed as healthy and strong, or my immune system stayed as strong as possible. And that's been my life.
Thank you so much, Ellie, for that particularly vivid sense of how leadership needs to respond when faced with the kind of challenge that COVID-19 presents to all of us. And I know that there will be a question or two for you and for Dr. Moses.
I just want to just say one thing, and you said the right word. You know what? I think politicians, and many of them, were grasping at how do we stay relevant,
Mm-hmm.
and it's like, and what I think the community has seen is that, you know what? We don't need politicians right now. We need leaders. We need people that are going to take actions. We need people that are going to help us. We need people that are going to keep our families safe. You know, we don't need the same, you know, words and, you know, empty promises. It's not the time. Wait for after we pass through this. And that's what I saw also, you know, that I definitely transitioned into a role of trying to be a community leader as best as I could. You know, but and some politicians, like, you know, they're like, if you need me, my office number is this. Like, okay, we don't really need you. You know, it's like, what do we need you for? So, yeah, you're right. Politicians, I think, rose to the occasion and became leaders, and the other ones, they stayed politicians.
Thank you. That's an important distinction, and I think it's something that's very much on the minds of people in countries around the world. That you know, lahavdil, there are politicians and there are leaders, and it's the leaders who are bringing us the information that we need. Particularly appreciated your emphasis on, which I think underscores something that Dr. Moses spoke of, your emphasis on education and clarity of communication. And you know, for all of us, we express our thanks for that to your administration, and I hope that it's had an outwelling effect. So thank you very much, and also both of our initial speakers for coming in under 20 minutes and being so coherent and careful in their presenting. So I suppose that presents yet another challenge for our next speaker, Dov Zakheim, who has his full 20 minutes offered to him, and whom we are very eager to
No
hear.
pressure, Dov.
No pressure whatsoever. So the questions that I'd like to pose for you just to get started has to do, of course, with the degree to which we might understand Bibi Netanyahu's return to power as in some way, because of the coronavirus pandemic, and what you might see as the political outlook for U.S.-Israeli relationship with Bibi at this, as he apparently takes power again. And secondary to that, just as we were curious in asking Dr. Alon, what is your perception of the degree to which Haredim might come to be more amenable or open with the larger society as a result of their experience during the pandemic? The floor, sir, is entirely yours.
Well, thank you very much. Thanks for having me. I had made some notes, and it started with Bibi Netanyahu, actually, so we're on the same page. I think one of the ironies of this so-called national unity government is that it was created to fight COVID-19. They haven't been sworn in. Netanyahu's now postponed it from Wednesday to Thursday. And as you heard from the doctor, the country is slowly recovering, at least it thinks it is. So the basis for Benny Gantz's, what many people think is a capitulation to Bibi, it seems to be falling away. But Mr. Netanyahu, whom I've known for a long time and haven't been a strong supporter of for just about as long, Mr. Netanyahu is back as prime minister. And what's he talking about? He's talking about annexation. And you have to think about the second and third order effects of that, particularly as how it'll affect American-Israeli relations. It's not just the Democrats who are going after him on this. Even Jared Kushner slowed him down in January when he wanted to annex the Jordan Valley, it looks like. And now you have a situation where David Friedman, the ambassador to Israel, who, as everybody knows, has very close ties in Beit El, which is a settler hotbed, has openly said he supports this, but Washington hasn't said anything at all. That in and of itself is an indication that there may be some hesitation back here if Bibi goes ahead. Now, why would there be hesitation? I think that goes to what the disease is doing specifically to our military. You're certainly aware of what happened on the Theodore Roosevelt, the aircraft carrier, where the Captain Brian Crozier sent out a note to everybody except his direct chain of command, basically in a panic, and it led to the resignation of the acting Secretary of the Navy, who happened to have worked for me and is still a friend. But the thing about the Roosevelt is that it's not the only place where COVID-19 has been affecting. The Chief of Naval Operations, Michael Gilday, is at home for a week because one of his family members has been affected. The head of the National Guard, General Lengyel, Joe Lengyel, was tested positive, then he was tested negative, now he's being tested again today. And that raises the whole question of how capable our military is in the face of a potential threat, because it's not just our military, it's all our NATO allies, it's our partners, it's our friends. And we see that China in particular has been pushing very hard in the South China Sea. We don't know what Mr. Putin will do. He's been affected as well. His own country is suffering badly. We don't know how badly. They won't tell us. But the point is that the disease is, I think, going to force us to think about how we can manage all over the world as we have until now. And that begs the question of where our regional priorities are going to be. And that in turn begs the question of whether we're still going to be as concerned about the Middle East as we once were. You got to remember Mr. Trump, who is venerated by the strongest pro-Israel advocates and is such a good buddy of Mr. Netanyahu and all the rest of that. Mr. Trump was the one who wanted to get out of the Middle East. What happens if he's reelected and the virus comes back and our military is impacted by that? Does he say, well, look, the Iranians may not be as strong as they think. They fire missiles at their own ships. They blow them up. We can get out. What does that do to Israel if at the very same time there's a strong reaction against annexation? And not just, by the way, by Democrats, but by some Republicans, by many in the US government and the bureaucracy, and by probably the majority of the American Jewish community. Given all of that, I think Netanyahu is taking a massive risk. But he, one of the things I've noticed over the years, I guess it's because I'm old now, is people who have been in a job for 10 years or more think they know more than anybody else. Look at de Gaulle, look at Tony Blair, Merkel even. They get pushed out. And one of the reasons they get pushed out is because they won't listen to any advice anymore. I mean, who's advising Netanyahu? Somebody who's young enough to be his son. Most of these people are young enough to be their sons and their daughters. So they don't really listen unless it's yes men, like someone else who happens to be running my country, who has the same problem, quite frankly. Well, if you've got yes men and you think you know better because you've been around so much longer, you're not going to think of consequences. You think you know all the consequences. So I think one outcome of this disease at a very macro level could be an intensification of a divide that I'm seeing between America and Israel anyway. Don't be fooled by the fact that Mr. Netanyahu and Mr. Trump are so close, that Jared Kushner and Mr. Netanyahu are close. Just look at the reality of, say, Israel's relationships with the Arabs in the Gulf because of Iran. On the one hand, you've seen Bahrain and the United Arab Emirates asking for some help on the COVID side. On the other hand, King Salman and Sheikh Abdullah, the foreign minister of the Emirates, have already condemned any annexation. So if Bibi goes ahead with annexation, what does that do to the relationship, particularly if the Arabs conclude Iran may not be as big a threat as they think? This is not, by the way, this naval mess is not the first one that Iran committed. The Iranians have really had problems with their military. And at the same time, of course, their economy is in the dirt. And there's tremendous discontent. Well, all of that weight on the one hand and annexation on the other might just lead these supposed Arab friends to say, you know what, we're going to back away again, which would undermine a lot of what Mr. Netanyahu has been trying to do for the last 10 years. So now Israel could find itself back in the box. It was even in a worse box than it was in the 70s. Because if annexation goes ahead, one other thing could happen. The European Union, which is not exactly the closest friend of Jerusalem's, could finally opt for BDS. And if you get a Democratic president, and I'll get to that a little bit more momentarily, the United States might not veto a Security Council resolution to support it. Now you'll have a situation where politically and economically, Israel is in a lot worse situation than it is today. Now I want to talk a little bit about where this election might be going. The answer is, of course, we don't know. But just today, for instance, the Trump people sent out one of their emails, that they sent all their supporters, which focused only on China. It's not, obviously, Mr. Trump doesn't want to focus on the disease. He doesn't know now whether he'll be able to open up the economy anywhere as quickly as he'd like. So he's focusing on the fact that Mr. Biden is a panda hugger. Well, that may or may not work. If it does work, I think this will be a further clouding of Mr. Netanyahu's sense of the future. Unless you see a Democratic Senate, which could happen even if Trump wins. Basically the Democrats need to win 4 seats, and right now it looks like there are 8 that are vulnerable on the Republican side, which means you don't have Mr. McConnell, who, by the way, has always been a good friend of Israel. You'll have Mr. Schumer, who's much more nuanced because he'll have to look after that part of the party that seems to be getting stronger. I don't know if it's stronger, certainly louder in terms of its anti-Israel rhetoric. So a Democratic Senate will already put certain brakes on even a Trump administration. And of course, a Biden administration with a Democratic Senate, now you've got a real problem if annexation goes ahead between now and November. So the disease which brought Mr. Netanyahu back to power could also undermine, by extension, a lot of Israeli relationships that it's had that it basically took for granted. I mean, Israel has taken the American relationship for granted ever since I've been in my business. I remember one time I was having a discussion with somebody about giving some funding to Israel, and I said, do you want a blank check? And this person said, why not? Israeli person. There is that mentality, and that is changing in Washington, and it's changing around the country. And Mr. Netanyahu's base, if you want to call it that, in America, is not really the Jewish community. It's the evangelicals. Because those Jews who support him the most strongly, namely the Orthodox, are what? 10% of 2% of the American population? Nothing. Now, what's exacerbating all of this is, and this is in my hat as the head of the chairman of the Jewish Religious Equality Coalition. And by the way, one of the reasons, as an Orthodox Jew, you might say, why did I create this? Because Steve Boehm of the AJC and I created it. After all, it reaches out to Reconstructionist rabbis and Reform rabbis and, atheists and what have you. And the reason is very simple. It was a national security issue for me. The majority of American Jews no longer feel anywhere nearly as strongly about Israel as they did in the past. I mean, after all said and done, if you're under 55, you don't really remember the 6-Day War. It's ancient history. What you might remember is intifadas. And then if you have any sympathy for the Palestinians, you'll go, well, you know what? Israel's the big bully. There is no memory of 48. There is no memory of 55. There is no memory of 67. There's barely a memory of 73, which is already 47 years ago. So younger American Jews They're just not there. There's nothing to grab them. Mr. Netanyahu certainly isn't going to grab them. And Israel's, annexation, do you think that'll grab them? So there's a problem here, which now gets exacerbated by the Haredi power in Israel. Now, those of us who are on the steering committee of JREC were hoping desperately that Gantz, whom I know and is a good guy, would become the prime minister and might be able to form a government without Haredim, or at least without, Shas, I don't worry as much about. Shas is very, very pragmatic. Maybe not as much as it was under Rabbi Ovadia Yosef, but still reasonably pragmatic. The others are not. The others are just hard over on moving to the right. And between them and the settlers, you got a problem. But when it comes, of course, to relations with American Jews, Shas is also as difficult. And so you now have something that exacerbates all the political military stuff I was talking about when it comes to the Jewish community. That, to me, is the fundamental problem. And that, by the way, is part of the legacy of COVID-19. At the end of the day, one of the things that COVID-19 has done, and I think this is, I don't know if it's permanent, but it's certainly going to last for a long, long time, is demonstrate that the international elites that, go to Aspen or go to Davos and have been talking to each other, basically ignoring the rest of the world and saying, oh, we're not really nationalistic anymore, which is true. They have much more in common with each other than they do with the lower classes in their own countries or the middle classes in their own countries. That's going away. And what you're going to see instead is what you see at soccer matches, where ordinary folks go. Look at the World Cup. Look at the Eurovision contest. That's not international. That is as nationalistic as you can get. And this disease has brought that out even more so. Countries closing their doors to others, right? Not letting people in. Nobody's flying. And once you bring nationalism in and you bring out a distrust of the other, that ain't good for Jews. It's not going to be that good for the community here, and it's not going to be good for Israel, because Israel's one nightmare is to become a ghetto, a state, but a ghetto anyway. That is the challenge. Why don't I stop there?
Thank you so much. We all appreciate both the broad overview and some really specific examples that help us understand that overview. I have a list of questions. Many of them, at least the first ones, are to a certain extent medical questions. So Dr. Alon, will give you the honor of first responder to these, and then if either Deputy Mayor Katz or Dov Zakheim have comments to add, they would be most welcome. There are some specific questions of small, not small, of just specific concerns. Dr. Alon, you mentioned that Haifa was relatively unaffected by the virus. Do you have some sense of the total number of cases compared to Jerusalem or Tel Aviv that you could give us? You're muted still.
Sorry.
That's
In
okay.
Israel, there was a total of just over 16,000 cases. At this point, there are around 5,000 or 6,000 active cases, and more than 80% are in Tel Aviv, are in Jerusalem and Bnei Brak. Haifa has hardly any cases. Tel Aviv right now has 500 cases. So if you look at the relative numbers, this is about it. About 80% are in 2 or 3 large cities: Bet Shemesh, Jerusalem, and Bnei Brak.
Okay. There are 2 questions having to do with forms of or consequences of outbreaks in two parts of the world that you might have some information about for us. And then there are some questions about hydrochloroquine. First of all, we have an inquiry concerning why the French Jewish community seems to have been affected more than any other French demographic. And secondly, there's a question from Canada where the major outbreaks have been in meatpacking and long-term care facilities. So aside from religious gatherings in Israel, are you seeing similar clusters? And if you are or are not, there'd be some comment on that would be appreciated. So some insight into what's going on in France and a question comparing Canada to Israel, if that's possible.
There are a few countries in Europe who've have been hit worse than others. You know, Spain, Italy, France are the worst. And I don't have an explanation for the focus in the Jewish community. I was asked by some French Israeli immigrants, why are we so tough about not going to Bet Knesset? And I think it must be something with their behavior that it took too long for them to realize that they should distance. I don't have any other explanation. You know, religious gatherings, we've seen in Korea, just in the beginning of the pandemic, that, you know, there were hundreds of cases from religious groups. So obviously any group, it doesn't matter what they believe in, any group. You know, in Israel, we had the Purim parties were the beginning of the outbreak here. You know, just young people being happy together. So, you know, I don't think that there's much of a difference where it happens. Although we also will learn about that. You know, why men are more sick than women, why children are less sick than adults. There are many issues that we will know more. And I wish I could be like Dov, who really, I think, understands the politics much better than I understand the medicine.
Well, it's all pretty complicated, and to the degree that we're constantly being asked to make risk assessments without complete information, everybody's facing a challenge at this point. Do you have any sense, Doctor, in Israel, whether meatpacking plants or long-term care facilities have been sources of outbreaks? And if they haven't been, then why might that be different than in other countries?
I think that the infection rate is similar across the ages, you know, certainly in the adult ages. So an elderly person is not more at risk for being infected than a young adult. But the risk of severe infection and death is much higher. So we've seen outbreaks in 3 or 4 homes for the elderly where it was devastating, you know, 20, 30, or even more % of the population died. And, you know, I know this happened in New York as well. So I think it's a question of the risk for severe disease. And that's certainly worse for the elderly. We've not seen any issues in factories. We have not seen any.
Thank you. The last specifically medical question has to do with the competing research conclusions about hydrochloroquine, which some studies seem to show may have some benefit, and many studies show are extremely, that's extremely unhelpful and in fact dangerous. Do you have a bottom line for us on that?
Yeah, I think I've read every paper on hydroxychloroquine since we set to do the study. And as I said before, in vitro it has an effect. In vivo, there are conflicting data. And I think the main point is that till now there's no properly designed, a randomized, controlled, placebo used trial to show whether really there's an effect. And I think that since the hydroxychloroquine is effective against the virus, it has a very good chance of working when it's given very early as post-exposure prophylaxis. You know, if you look at other medications, we really know from infectious diseases that prophylaxis works wonderfully. When you give it against malaria, when you give prophylaxis against animal bites, when you give prophylaxis before surgery, you know, if we give the medication early enough, it can work. If you give the medication once the patient is very sick, there's, you know, the horses have left the stable, we say in Hebrew. So it's too late to bring them back. And concerning the side effects of hydroxychloroquine, it's really when it's given at a low dose for a short time, I mean, it has side effects like QT elongation of the EKG, but if you monitor this and you make sure that patients who are on other medications don't get it, I think it's a very, very safe drug. We give it for lupus patients for many years at high dose, so I think we have a good track history for it.
Thank you so much. As our closing question, before we thank you again for joining us to make these presentations, I'd like to ask Deputy Mayor Katz and Dov first to make some comments about their sense of the role of religious leadership in addressing the pandemic and how we, because most of the demographic to whom you're speaking right now, our clergy. What do you see as our role and what might we individually consider in our various communities around the globe?
Go ahead, Elon.
So
go ahead first and then Dov. Thank you.
I personally feel that the clergy play a very important role because I think right now this is a matter of instilling confidence and trust, and that comes in all different sizes and packages. People trust what they read, people trust what they watch, but you know what? Many of us trust our clergy and look towards them for guidance. And you know, my wife won't cut a carrot in the kitchen without first calling, make sure we're gonna use this knife, that knife, you know, and sometimes it's a positive, sometimes it may not be such a great positive, but I do think that we're fortunate, especially in Teaneck, to have a great group of clergy members, and certainly I'm meeting them more intimately now, ironically, even though we're distancing because of our calls every Sunday with the interfaith support calls. And you see how genuine a lot of them are, and especially since they're challenged themselves because they have the family that they're dealing with, but yet they're dealing with also their congregation and their extended community. But I do feel that it is important that our clergy disseminate good information, and I'll tell you, in Bergen County, the RCBC has been very vocal. They've taken a strong position and positions, and I think that they are also responsible with that moniker of that they saved lives by taking those positions. So you know, people trust their clergy, people like their clergy. You know, I personally walk out for most of the speeches for my clergy in my synagogue, but not as a slap in their face, just because it's a good relief for me sometimes. But you know, they play a pivotal role. I'm sorry for insulting any clergy members on this call.
Yeah,
Probably wouldn't walk out of your speech.
of course not. Of course not. And Dov, if you would like to have.
Well, you know, they can.
last word.
I think there's a plus. I think there's a minus, and I think there's an opportunity. The plus, I think you've heard a little bit about just from Elon. It applies to the Catholic clergy, the Protestant clergy, the Muslims, and to rabbis. If you go to church, you go to the mosque, you go to the shul, you've already made a commitment. And this, if the rabbis are sensitive and sensible and tell people to follow medical orders, which is frankly what the halacha tells you to do, then it's good for them as leaders and it's good for the community as the led. So that's the positive. The negative is when they don't do that. And we saw that in Israel, where some of the heads of the yeshivas, and I've written about this, basically said, hey, look, just don't tell Lashon Hara, don't snitch on people and you'll be safe, or give to this or that charity and you'll be safe, which is disastrous. I mean, you cannot overstate the danger that they've put people in. And it took weeks before some of these leading rabbis turned around. So, if you're a leader of a flock and the flock is a bunch of sheep and you tell them to jump over the cliff and they do, you're not doing them any good. So there's a good and there's a bad. Now, there's not an ugly. On the contrary, I think there's an opportunity for a significant number of Jews in Israel, significant number of Jews in America and elsewhere in the world. They don't follow rabbis at all. They're secular. And it seems to me that it's an opportunity for rabbinic leaders of whatever stream or orientation to demonstrate leadership, to reach out to anybody they can reach out to, and to emphasize the importance of good health, of taking the right measures to prevent the spread of this disease, and to demonstrate that a spiritual leader cares about everybody. I think that is a huge opportunity, particularly again for many young people in America, and I suspect in Israel, who aren't negative about religion or about religious practice. They're indifferent. That's a very, very different thing. And if you're indifferent, that means that nobody's given you anything to make you interested. This is an opportunity for, I think, rabbinical leadership to do just that. So as I say, there's a good, there's a bad, and an opportunity.
Thank you so much. Our last word goes to the chair of the Ruach Hidush Executive Committee, the eminent Rabbi Michael Chernick.
Well, we're so glad that you joined with us. I hope the webinar was informative. I really want to thank Rachel for moderating and all of our participants, Dr. Alon, Moses, and Eli Katz, and Dov Zakheim for being with us. You did a wonderful job, and we're so pleased that you could join us and be as informative as you were. Have a great day, everybody. Thank you for coming, and thank you for joining our webinar. And be well, and be safe, and be healthy.
Tune in next week for Uri and Rabbi David Saperstein.